Hello, I'm Dr. Nicordelai Corte, AARP Senior Advisor and National LGBTQ Liaison. I couldn't be more excited to be right here at the Out and Equal Workplace Equality Summit with so many champions that are deeply committed to equality and realizing the untapped potential of diversity, equity, and inclusion. AARP has had a long history of being an advocate for marginalized and vulnerable adults, including LGBTQ older adults, of which we have an estimated 1.156 million self-reported members, up from 900,000 when I joined AARP over 5 years ago. Throughout the enterprise, there are dozens of departments working tirelessly to find new and innovative ways to show up as an ally organization in support of LGBTQ older adults, including but not limited to our Office of Diversity, Equity, and Inclusion, our research department, our human resources department, our foundation, our procurement department, and of course, government affairs. They add so much fuel to this work. You know, the purpose of this workshop today is to share how and why AARP thought it was necessary to become a more visible ally for LGBTQ people. We're going to discuss our growing canon of research, including findings from the AARP Vital Voices Issues survey that impacts U.S. LGBTQ adults age 45 and older. Also, our Black LGBTQ Community Study, which was a partnership between AARP, Human Rights Campaign, Freddie Mac, the Center for Black Equity, and Wilson Media. In addition to the discussion on research, we want to share how different parts of the enterprise are advancing the LGBTQ work at AARP, such as the work that's being led by our Director of Supplier Diversity, the partnerships that our staff in the Office of Diversity, Equity, and Inclusion have built, and the amicus briefs AARP has filed against the Social Security Administration for wrongly denying benefits to LGBTQ people, and of course, our measures to advocate for the passage of the Equality Act. Ultimately, AARP's work in the LGBTQ space moves past Pride season and is a part of our social mission and is proudly a focus of our work 365 days a year. We welcome you to join us as we discuss these and so many other initiatives, programs, and strategies that inform our daily practice to become a more effective and affirmative organization of allies inside and outside of the DC Beltway. And so with that, we're going to move straight to questions. There are so many opportunities for learning here, and we hope that you all lean into it. I am joined in studio with Bill Rivera, our Senior Vice President of Foundation Litigation. I'm also joined with Christina Martin Frevita, our Vice President of Financial Security and Consumer Affairs in our Government Affairs unit here at AARP. And then joining us remotely, Cassandra Cantave, our Senior Research Advisor, and Kimberly Marcus, our Director of Supplier Diversity. And so I really want to go to the first question, which is around allyship. Can you tell us about the genesis of your allyship with the LGBTQ community? And Kimberly, we'll start with you. Is there an issue or a person or an experience that made you want to be an ally of the LGBTQ community?
Thank you so much, Nicordelai, and I really do appreciate being here today. So it really starts from my upbringing. As you can see, I'm an African-American woman. I was raised in Oakland, California, and was raised by a single mother because she and my father divorced, when I was 3. So while growing up, by 5th grade, believe it or not, I could not read. And they didn't know why I could not read. And they said, we're just going to go ahead and put this young lady back in the 3rd grade. And I was already this height, I'm 5'9", right? And there was a woman by the name of Virginia Johnson who said, we won't do that. I will be her advocate. I was her 5th grade teacher. I will now be her 6th grade teacher. I will get her to where she needs to be. I was diagnosed with dyslexia. I got the tutoring that I needed and the advocacy that I needed because I truly was being marginalized and set aside, right? By the time I graduated from high school, I had a 3.8 GPA and got a full scholarship, academic scholarship to college. And I'm saying all that to say, because there were people who helped me and made sure that I was not set aside, I made my life's mission to help others, which brings us fast forward to family members who did not feel comfortable living in their own skin, and they are a part of the LGBT plus community. And I said, that's where I reside. It is my mission and my goal to help people feel comfortable and bring their authentic selves to not just work, but their everyday environment. And that is why I am an ally of the LGBTQ plus community.
Thank you for sharing that, Kimberly, and always lovely to share a moment with a fellow from the Bay Area. Back in studio, I want to turn to Christina Martin-Fervita with our Government Affairs Unit. Christina, can you tell us about the genesis of your allyship with the LGBTQ community? Is there an issue? Is there a person? Is there an experience that made you want to be an ally of the LGBTQ community? And before you answer that, let me just say that I'm going to take a moment of personal privilege. I had a chance to work very closely with Christina in terms of advocating for AARP's support of the Equality Act. We were partners in that, and we'll always be connected in that on the 50th anniversary of Stonewall to the day, Christina played a major role in making that happen. And so what a powerful demonstration of your allyship here at AARP. I'm curious, what inspired that?
Well, first of all, that was a privilege to be able to do that on that anniversary, and that was very deliberate. We were very thoughtful and intentional about that, and that's always been a highlight for me of the work we've done together here at AARP. I was very privileged when I was a high school student to know an educator who I'm not a young lady, so this was a long time ago. I knew an educator who had the courage and the dignity to be out. And I think many young people know someone who is in this community, but they may not know that about them. I was lucky enough that I got to know him and I got to know who he was. And he was a real mentor to me. He really encouraged me in a lot of different ways. I credit him with where I got to in school. And he really opened my eyes to a whole set of experiences that were, before that moment, I was blind to them. I had no idea. And then the issue that played a very important role, it was around the same time, this was in the 80s, it was being, a college student during the AIDS epidemic, and knowing, and I was involved in theater and performing arts, and knowing so many people, so much talent and so much love that was lost. And that really made me want to help, to be a part of what made it right. And here we are.
And here we are. We're also joined with Bill Rivera, who leads our foundation litigation, our litigation unit in AARP Foundation. He's been an incredible champion over the years. I remember getting my first email from Bill with the thumbs up that we were moving forward with filing an amicus brief on an LGBTQ case. I think I was on Travel in Dallas. And I thought that was going to be one of my biggest highlights in this role at AARP. Since then, there have been several cases and several emails from Bill giving me the heads up that we were filing. So I just want to thank you for being an awesome champion and for making so many of us feel like we belong, not just here at AARP, but that we feel like we belong in a way that is deeply connected to our mission. And so where does that come from, Bill? Tell us about the genesis of your allyship in the LGBTQ community. And again, if there's any issue or person or experience that made you say, you know what, I really want to be, I really want to show up for this community in a really special and unique way, using my talent, my skills, and leading with my heart.
Well, thank you, Nicordelai, and it's been just an absolute pleasure and a privilege, really, to do the kind of work that we do, and to really think about the Foundation's mission in particular on really trying to focus on the low-income and vulnerable populations among those who are 50 and older, and to be able to do that every day and to have great colleagues as we have here today across a number of different issues of great importance is tremendous, just absolutely tremendous, and makes it a pleasure to come here every day. For me, I grew up in Brooklyn in the 70s and 80s, and my landlord, Jose, was a wonderful man who became a very close family friend. Think kind of like Schneider on One Day at a Time, right? And he became like an uncle to me as I was growing up, and he was gay. And this being the 70s and 80s, being a Puerto Rican gay Catholic man was not the easiest thing necessarily to navigate. But when you grow up loving and respecting someone, that just wasn't even an issue for me. But I certainly found myself often having to vouch for him or otherwise stand up for him among friends and neighbors who didn't have the same perspective on him that I did. You know, people would talk quietly as he would come in and out, and he was very private in certain respects about that, as one often was at the time. So that was something that just very early on stuck with me, and then certainly as I made my own professional journey and got involved with a lot of diversity and inclusion issues throughout my career, particularly with the Hispanic community, I learned more and more about the importance of different identities and often the intersection of those identities. And more we have seen the LGBTQ identity really cross over so many other identities, whether that's aging, whether that's ethnicity, gender, race, et cetera. So it really has just become such a bigger part of that broader, more complicated professional and socioeconomic fabric that I'm really proud that we've been able to really make that as much a part of our growing work in the courts and elsewhere as we have.
Thank you for that, Bill. I want to turn to Cassandra, who, in addition to serving as our senior research advisor, she is the chair of our LGBTQ PRISM Strategic Engagement Employee Resource Group here at AARP. Welcome. She's joining us from Atlanta.
Thank you so much, Nicordelai. I'm so honored to be here. For me, I came out of later on in life, and one of the first things I wanted to do is to find people within the profession that I could align with, people that looked like myself. And so I became very vocal, not only about my allyship, but also my story, sharing my story, because there are so many people that are still closeted, that are, professionals. And I always wanted to create a space where people felt safe, which was the other reason why I actually joined and became chair of the LGBTQ PRISM SERG, because I wanted people to know that there was a safe space for them where they could feel supported, seen, heard, and validated. And then once I was able to actually do the work in my capacity as a senior research advisor, that made it all the better, because I knew that together with others in the organization, that we could really tackle some issues that are facing older LGBTQ people. And I'm very, very proud of all of the work that we've been doing.
Yeah, I just want to build off of that, and thank you for sharing that, Cassandra. Can you tell us a little bit about how you define ally, and are there any examples that come to mind, demonstrations of allyship that you're most proud of during your tenure here at AARP? Lots of talk about allyship, but I think sometimes our shared definitions and shared meaning vary.
Right. I know we often talk about allyship and champions. And I think often people think of allyship in terms of, yes, I'm going to be supportive with this group of people. And I think true allyship is not just saying that you're an allyship, but actually showing up, advocating, supporting, and being very visible I think within the organization, there are plenty of people. I think Kimberly Marcus stands out. I think everybody on the panel, Christina, Bill Rivera, I think of my colleague in research, Angela Houghton, who is a white woman from Baton Rouge, and she is so adamant about learning, about doing the work properly, and being a true champion for all people. And I think, across AARP, like I said, there are lots and lots and lots. Deb Whitman, of course. We have Edna Kane Williams, who is our Chief Diversity Officer as well. And I think across AARP, you will definitely see, lots of people that are not just paying lip service, but that are actually demonstrating championship.
That's right. And big shout out again to Angela Houghton on the research team. We had a chance to work very closely together on our landmark LGBTQ research study called Maintaining Dignity. I encourage folks to go to aarp.org/pride to check that out and so much more that we have to offer in terms of our ongoing LGBTQ insights that we have to share. But I want to go to Kimberly Marcus, who is a leader on our supplier diversity team, and just another extremely talented and thoughtful ally. Can you tell us a little bit about how you define ally, and again, any examples you have of that demonstrate your allyship? Any examples that you're most proud of? In part because sometimes allies don't know when to step up, and they also don't know when to step back. And I've had a chance to work with you over many years, and you've been a gold star ally in that way in terms of knowing when to step up and step back.
Thank you so much, Carla. I really do appreciate that. And I think Cassandra is spot on. So most recently, I heard this from a presenter on DE&I, that an ally is someone who cares about the cause. The accomplice is someone who works towards the cause. And a co-conspirator is someone who's willing to give up something, right? So I consider myself a co-conspirator because I'm willing to give my seat at the table in the boardroom, in business conferences, to allow those who aren't normally invited to have a seat at the table. And that's where I think you were kind of pointing to me, Cordelia, where I know to step in and when to step out. So I'm about pushing the envelope, kicking down the door sometimes, but then not necessarily me walking through, allowing someone who isn't normally able to be in the room. And that's how I try to be an ally to the LGBT plus community.
Thank you, Kimberly. Allyship is not just about showing up, but it's about creating more opportunity, as Kimberly just outlined, more opportunity for folks that have been historically disadvantaged. In this case, any organization supplier diversity team really plays an outsized role, and Kimberly has done that over many years. Quickly, Kimberly, under your leadership, can you share some of the greatest hits in terms of how AARP's supplier diversity team has led the way?
Absolutely. Thank you, Nicolai. So when I was brought on board 6 years ago to really revamp the supplier diversity program, AARP was not at a space where they really knew what space we should play in supplier diversity. And I was very intentional saying, not only are we going to work with minority businesses and women businesses and veteran businesses, because those were the three categories that everyone pretty much knew of. I said, we are also going to include the LGBT plus and the disability community. While there may not be as many certified LGBT plus communities, let's be one of the corporations, one of the associations that is groundbreaking. Let's work with NGLCC, put our money where our mouth is, and support these suppliers so that they can do business with AARP, so that we can be mentors to them, so that we will provide money for their conferences. So we'll provide money for them to get certified. We will provide money so that people who look like me and you can also be certified as LGBT plus community members. So we're as a badge of honor, right? So many times the LGBT plus community, as well as the disability community, don't want to get certified because they're like, we may not get business because we are telling people we are part of that community, where we at AARP say, no, we want to do business with you. You are a big category in our supplier diversity supply chain, and we will either work with you or align you with a tier 1 business so you can do work with AARP.
Thank you for that, Kimberly. Thank you for that. Building off of that, allyship can be measured by what you say and what you do. And in this case, on the 50th anniversary of Stonewall to the day, AARP publicly endorsed the Federal Equality Act and urged the United States Senate to pass it. Christina, can you tell us how this happened and what it meant for AARP to weigh in on one of the most important civil and human rights issues of our time?
Yeah, absolutely. That was a privilege for us to be able to work on that issue together. And I want to credit Bill and his team, because I think this is also a great illustration of how at AARP we try to put the puzzle pieces together, and we really understand that you gotta the fight is in different arenas, and what happens in one stage of the fight can really create an opportunity for another stage of the fight. And so I know that AARP Foundation was getting ready to do an amicus brief, and I know that we're going to talk to Bill in a minute about the litigation strategy that we have. And equality had really evolved from the many years that ENDA had been introduced and reintroduced and reintroduced and hadn't really gotten as far as advocates wanted it to. And it was time to really say, is ENDA enough? And it isn't, right? We know that it's not. And so we were discussing, if we're going to do this amicus brief, why don't we do that? Why don't we do that endorsement at the same time, so that we're really elevating each other's messages? We're amplifying what we want to tell Washington, what we want to tell the courts, what we want to tell Congress. But most importantly, by holding that letter, and we made that decision together as an enterprise, but we also agreed that by holding that letter until that Friday, until the anniversary date, more than that, we were really letting the letter send a message in commemoration, and in solidarity, and in love with the community. And I know that we planned ahead with our state offices. There were a lot of state offices that were looking for something that they could share with the community as they were doing their own Pride events and in their communities. And we said, listen, we know it's going to be late in the month, but we have an idea that we think would really be bigger than other letters we could write on other dates of the month. And so it was a coordinated action between foundation litigation, between the media relations team, between the state offices, the government affairs shop, with your team, of course, and just trying to find a way to make the words we say in a letter, how to get the most value out of them as advocates, but more than that, how to really turn that into a love letter. We love you, we see you, and we want you to know that we're here for you.
Awesome, awesome. Really one of my proudest days on the team. Thank you for that. Bill, I want to bring you into the conversation again. Allyship is not strictly about changing hearts and minds. It's about drawing attention to the desperate impact laws have historically had on marginalized groups like the LGBTQ community, particularly LGBTQ older adults. Bill, can you tell us how AARP Foundation litigation has turned up the volume as an ally of LGBTQ older adults in recent years, and what positive net effect this work might have on older adults everywhere?
Absolutely, and I want to echo Christina's comments, because we really do all of the work that we do with such coordination, and you really need to be purposeful to be impactful. And I think we try to do that, making sure that we are working with our government affairs colleagues, with our folks in the Office of Diversity, Equity, and Inclusion, with state offices when we're talking about policies that are at the state level as well. And so my team will use the courts. We get the Court of Public Opinion, and we get the actual courts of the United States and various states to try to drive social change. And we do that on behalf of older adults. And we started a few years ago really looking at the LGBT community, because as the Maintaining Dignity report, among others, has demonstrated, you have a lot of concern among LGBTQ older adults about how they will age and the kind of discrimination that will affect them in employment, in healthcare, in housing, in benefits. And so we have very deliberately tried to move into that space by, among other things, either on our own on behalf of AARP and AARP Foundation, and often with colleagues like SAGE or the National Center for Lesbian Rights or Lambda Legal and other LGBTQ organizations, to file what are called amicus or friend of the court briefs, where we will file a brief to explain to the court our perspective on the issue, both the legal issues and then the broader impact that that will have, particularly with respect to older adults, because those issues aren't necessarily going to be front and center for the parties of the case. But we know that the decisions, especially when you're talking about the US Supreme Court or federal courts of appeal and so on, that if they say that a law includes sexual orientation and gender identity, for example, when the statute uses the word sex to protect people from employment discrimination, that will have a tremendous impact in terms of what the opportunities are, both for bringing individual cases, but more importantly, what is the incentive for employers to behave the right way, to not discriminate against you with respect to your sexual orientation or your gender identity. So we filed a brief in the US Supreme Court in the Bostock case with a number of other civil rights and employment organizations. We filed the brief that you talked about earlier in the Wetzel case in Illinois regarding the harassment that individuals had received because they identified as LGBTQ in their housing. And so what was the obligation under the Fair Housing Act to protect people when you know that they're being harassed because of their orientation or their identity? We filed a brief to support the inclusion of sexual orientation and gender identity under the Affordable Care Act's prohibition on discrimination in the provision of health care. And as you alluded to earlier, also we have filed briefs in support of including the spouses or lifelong partners of LGBTQ individuals who didn't meet the legal requirements for being married long enough to earn certain Social Security survivors benefits because it simply wasn't legal in their state to be married. So it's really very important work. I think it's very much of a piece with AARP and AARP's foundation's historical concern for the vulnerable populations as they age. And it's just really tremendously, I'm just so proud of that work and really the colleagueship that we've had across the enterprise to do it.
Absolutely, absolutely. There's so many reasons to be proud of this work. And so none of this work is possible without data collection. Data collection that makes all of us under the rainbow more visible. Cassandra, you've heard me say this probably a million times. If you had a nickel for every time I've said this, right? There'd be a lot of nickels in that jar. No data, no justice. No data, no justice. Can you share a few examples of how AARP is growing the canon of LGBTQ research on older adults and how you think AARP is positively creating the kind of culture change that will fundamentally make LGBTQ older adults more seen, more heard, more protected across the country and beyond?
Oh, yeah, absolutely. Along with what you always say, I've also heard that data is a powerful advocacy tool. And I know, Bill and Christina talked a little bit about how AARP has entered the arena in terms of advocating for our LGBTQ folks. And I know that also some of the data from Maintaining Dignity was used for those amicus briefs. We've been growing our canon since probably about 2016. Maintaining Dignity was the first report that we did. And since then, we've done State of LGBTQ Dignity 2.0, which is a supplement to Maintaining Dignity. And in that research, we looked at some workplace issues in terms of what do LGBTQ people want and in the workplace to make them feel supported and respected. We've also, you mentioned early on, partnered with some great organizations on the Black LGBTQ community study, because we also know that data on older Black and Hispanic Latino individuals is missing. There's a dearth in that research. We've also done Vital Voices LGBTQ research. And so, I can go on and on about the types of research that we're doing and the data points, but all of this work is really to help inform different departments within AARP. It is to help with our advocacy, our outreach for LGBTQ older adults, and really to help people understand that AARP is an organization for all people. We know also that if you look at the numbers in terms of LGBTQ people that feel that they've been discriminated against because of their sexual orientation and gender identity, it is really high. And just because we're in 2021, it doesn't mean that these things do not occur. And so I'm definitely very, very proud of that. We're also looking to possibly partner with some trans organizations, particularly around the United States Trans Survey, to see how we could help with advocacy and outreach and supportive services for older trans adults.
Thank you for that, Cassandra. Just another example of how much partnership is a tool. You mentioned the National Center for Transgender Equality, a group that we're looking to work with. And a lot of this work wouldn't be possible without partners. One of the partnerships that Bill alluded to earlier was how AARP Foundation, and SAGE, and the American Society on Aging, how they weighed in by filing an amicus brief in the United States Court of Appeals for the Ninth Circuit, arguing in support of LGBTQ surviving couples who were denied Social Security survivor benefits due to this requirement that they must have been married for at least 9 months to qualify for survivor benefits. And, this requirement discriminates against LGBTQ couples, we believe, folks who could not marry any sooner because of unconstitutional laws banning same-sex marriage, as Bill mentioned earlier. So additionally, our state offices across the country are holding events and having discussions and engaging communities and leaders very much in the same way that we're doing today, with the intention of educating and entertaining and supporting and really demonstrating our solidarity with LGBTQ communities nationwide. And so on behalf of our 38 million members and all older Americans nationwide, AARP, we are a proud ally of the LGBTQ community. There are plenty of LGBTQ folks that are members, that are volunteers, and that are staff here. And that's why we were proud to re-endorse the Equality Act, because here at AARP, we believe that all people have the fundamental right to be free from discrimination. And the Equality Act provides equal treatment under the law for individuals by prohibiting discrimination on the basis of sexual orientation and gender identity. Make no mistake, right here at AARP, we believe that LGBTQ individuals should be free from discrimination. from the entities that the 50+ traditionally rely on for support, such as healthcare institutions, housing centers, meal providers, senior centers, and other vital government services. And you can expect us to do our part as an ally organization. And so to learn more about AARP and our growing commitment to diversity, equity, and inclusion work, please check out our webpage at aarp.org/pride. I want to thank Bill Rivera from our Foundation Litigation team, Christina Martin-Fervita from our Government Affairs team, Kimberly Marcus from our Supplier Diversity team, and Cassandra Kantab from our AARP Research team. I'm Dr. Nicordelai Corte from our Office of Diversity, Equity, and Inclusion, signing off.